If you're trying to conceive and quietly wondering if life can be whole without a baby, feeling anxious, uncertain, or weary in your faith, you're not alone. Welcome to the Infertility and Trying to Conceive podcast for Christian women. I'm Linda Renee, an Aussie wife, mum, and follower of Jesus. Here I share biblical truth, simple conception tips, offer emotional support, and have honest conversations about what struggling to conceive really looks like as a Christian woman. My prayer is that this podcast lightens your load, keeps you anchored in Christ, and helps you move forward with confidence, peace, and hope. Christ goes before you, and I'm right here helping you look to Him every step of the way. Let's begin. Hello. Thanks for joining me on the podcast. I'm so glad that you're here, and I hope this episode brings some encouragement into where you're at with things right now. Today I'm looking at implantation. And from my experience, there's often lots of questions that circle around this. And so I thought that I'd touch on some things that are out there and look at some research, as well as my own personal experience with this. And I know for me, every time that I was in an appointment where they were measuring my endo lining, the first thing I'd be asking was, what's the measurement? Is the lining thick enough? And if it wasn't yet, or it hadn't gotten to the point in that cycle where it should be, then I'd be following it up with questions like, is there anything that I can do to help it along? Is there a way of knowing whether implantation has actually happened? And does everyone have implantation bleeding? All these questions would be running through my head. So today I want to give you a quick overview of what's happening with implantation, what can affect it, and what you can do to support it. So implantation is when an embryo attaches to the uterine lining. And from there, if everything continues, a pregnancy develops. It sounds straightforward, but there is so much that has to go right. The embryo has to be healthy enough. The lining has to be ready. The timing has to line up. And your immune system, which you'd think would reject something foreign, has to do this remarkable thing where it stands down just to let the embryo settle in, while still working normally everywhere else. For some people, that happens without any issues, but sometimes immune issues can play a role in implantation not happening or in early pregnancy loss. It's not super common and is still being researched, but it's worth knowing about, especially if you've had recurrent losses. So what determines whether implantation actually happens? There are a few things, and one of them is the embryo itself. And the embryo is probably the biggest factor in whether implantation occurs and continues. Whether an embryo has the right number of chromosomes, whether it's genetically healthy, that probably plays the biggest role in whether it implants and keeps developing. And that's mostly set at the point of fertilization. It's not necessarily something that changes based on what you do in the days after. This matters if you've had a negative cycle where implantation didn't happen at all, where you've had no positive test, nothing. That's different to an early loss where implantation did occur, but the pregnancy didn't continue. For a cycle where there was no positive test at all, there can be a number of reasons why implantation might not have happened. So if this keeps occurring, it's worth working with your specialist and asking them to run more tests. Because sometimes it has nothing to do with anything that you did. It might just be that the embryo wasn't genetically healthy enough to implant. And where there are no answers, that's particularly hard. Sometimes I find leaving it in God's hands is a relief, but other times it's very hard to do that, especially if it's been a long road of disappointment without much good news. But as I mentioned in a past episode, I think it was episode 17, when to see a doctor when trying to conceive, even in healthy couples with no known fertility issues, it can actually take quite a few cycles to get pregnant because so many things need to line up. And I know knowing that doesn't automatically make it easier to deal with emotionally, but knowing that it's common for conception and pregnancy to take time, because this is a genuinely complex process with a lot of moving parts, that can make a difference to how you handle it. And it's pretty common, I think, in trying to conceive an infertility to start panicking and have this underlying fear that there's something wrong with you. So if you're feeling that right now, I hope this episode will be helpful. So we've looked at the makeup of an embryo and how that might be impacting implantation. But that's only one part. The other big piece and one where you might have more ability to influence is the uterine lining. So in your cycle, your body either naturally builds up estrogen or you take medication or hormone injections to get your body to boost it. Then after ovulation or egg retrieval, your progesterone levels shift into a state where your endometrium can actually receive an embryo. That window isn't very long, and if the timing is off or the lining isn't thick enough, implantation can sometimes become a lot harder. And the embryo doesn't just land on the surface, it actually burrows into it. It releases signals, and the lining responds to those signals, and then that back and forth is what allows it to attach and start developing. If either side of that conversation doesn't happen right, implantation doesn't happen either, which is part of why it can fail, even when everything else looks good. I think most fertility specialists, at least in my experience, tend to be pretty happy if your lining is somewhere between 7 or 8 and 12 millimetres. Under 8 and it gets harder for implantation, but it's not impossible. Under 5 millimetres is where the research indicates that implantation rates can drop quite a bit. But thickness alone isn't everything. The structure of the lining also matters. Before ovulation or a transfer, doctors like to see what's called a triple line pattern, which shows the lining has 3 distinct layers and is responding properly to estrogen building up the way it should. If you've had monitoring scans and your doctor has mentioned any of this, that's what they're looking at. So if your lining has been consistently thin and your doctor's not addressing that, it's worth investigating further rather than just accepting it. There are things that you can do to help support your lining, and there are some underlying reasons worth looking into when the lining isn't responding the way it should. And there are conditions that can actually affect the lining and implantation that are worth knowing about. Endometriosis is one that consistently goes undiagnosed, often for many years. It can take a long time to get a diagnosis, sometimes because the symptoms feel like it's just something that you've had to push through, or it can feel taboo or awkward to talk about it with friends. And so you're not always sure what's normal or what's not, and it can go unrecognised. So endometriosis is where the tissue that normally lines the inside of the uterus grows in places that it shouldn't, outside the uterus or sometimes on the ovaries or your bowel or the surrounding tissue around all of that. And because it's in the wrong place, the body can't shed it the way it normally would with your period. And that causes ongoing inflammation in the pelvic area that the body is trying to deal with. And this can make it harder for an embryo to implant. It can also affect egg quality. If the eggs themselves develop in that same oxidative environment, that ongoing inflammation can affect how well they mature and how healthy an embryo is. And if endometriosis has caused cysts to grow on your ovaries, this can also reduce the number of eggs available over time. So endometriosis isn't just about periods and pain, although it often has that going along with it too, but it can affect your eggs and your chances of conceiving in ways that aren't always obvious. So if your periods are painful enough that you need strong pain meds, or that you're having to cancel plans, or that you have pain during sex, or you just have a gut sense that something in your cycle isn't right, keep asking your doctor to look into these things further. You are the patient and you can ask for these things to be looked at in more detail. Another condition that can affect implantation is adenomyosis, which is similar to endometriosis, but instead of the tissue growing outside the uterus like endometriosis, it actually grows into the muscle of the uterus itself. And this can affect how the uterus functions, which matters for implantation. It too often goes alongside endometriosis and is commonly missed on standard ultrasounds. And polyps and fibroids are different again. They're growths. So rather than the tissue growing in the wrong place, they can still get in the way of implantation depending on where they sit. A polyp right where an embryo would implant can stop it from happening. And if fibroids change the shape of the inside of the uterus, they can do the same thing. And none of these are automatic dead ends for conception or implantation or pregnancy, but they are worth working with your doctor and ruling them out. And another question in relation to implantation that can come up at times is that if you're going through IVF, sometimes people wonder whether using frozen or fresh embryos makes a difference for implantation. And I think the research on this has both pros and cons. Fresh transfers have the advantage of the lining being naturally prepared from your own cycle, but there is less flexibility to adjust if things aren't quite in sync. And frozen transfers allow a bit more control over the preparation of the lining, and some research shows that it can be slightly better in certain situations, partly because the lining isn't affected by the large amount of hormones injected when you do an egg retrieval cycle. But it really does come down to your own individual circumstances, so it's worth asking your doctor or your clinic that question directly if you're facing this decision. A few other things that might be worth thinking about when it comes to supporting implantation might also be things like iron levels. This can be something worth looking into because iron affects how your uterine lining develops. Your lining needs good blood flow and the right building blocks to thicken it properly, and iron is a part of that. What makes it easy to miss is that you can be low in iron and still feel relatively okay. It doesn't always show up in an obvious way like being tired all the time. So if you've been having heavier periods than usual, or just generally your periods are heavier, and even if you haven't, it may be worth getting your levels checked. It's a pretty simple blood test, and it's pretty easy to bring your levels back up again if they're low. So iodine's another supplement that you may have heard it called the golden supplement in fertility circles. And there's a real reason behind that. Because your thyroid needs iodine to function properly. And your thyroid, even when it's only slightly off, can have an impact on implantation and early pregnancy. Not obvious thyroid disease, just mild dysfunction, the kind that might sit at the edge of the normal range and not get picked up in a basic test. That can affect whether implantation succeeds for some people and whether an early pregnancy sticks. Iodine deficiency is more common, I think, than most people realise. In many parts of the world, including here in Australia, it's quite low in our soils. And the same is true across parts of the US and the UK and Europe and elsewhere around the world. You might find that you've cut back on certain foods that actually used to boost your iodine levels that bit more. Things like dairy. You may have heard that dairy can impact fertility, or you're just removing certain foods in case it helps, which is understandable, but your iodine might drop without anyone noticing. So if you've made some pretty significant changes to your diet recently, or if you haven't had a thorough thyroid panel blood test, not just the basic THS test, but a full picture including antibodies, it's worth asking for one, especially if you've had any history of things like fatigue, hair changes, irregular cycles, or early miscarriages. And I've probably touched on this before, but I do think it's just a good reminder to remember that fertility supplements, they can interact with each other, and some can interfere with fertility treatments or medications that you're already taking. So being open with whoever's supporting you, whether that's a naturopath, a GP, or a fertility specialist or someone else, about everything that you're taking, it can really matter. And of course, that can get complicated when different practitioners give you conflicting advice. One tells you to take something and another tells you to stop it. And when you're trying to find a middle ground between approaches, and those approaches don't always agree, it really can be tricky to know what to do. And I didn't really think of myself as much of a researcher until it came to trying to conceive. And then I found myself Googling or searching all these journal articles, every single little nitty-gritty detail. And so when it comes to any kind of research or you hear a big claim about a supplement or a method, if you have the capacity, it can be worth looking just that little bit deeper. Generally, the most reliable and what's considered the gold standard kind of research is called, now this is a mouthful, but it's called a randomized double-blind placebo-controlled trial. And that's basically where the person taking the supplement or the medication or whatever it is, nor the researcher, knows who got the real thing and who got the placebo. And in terms of supplement research in the fertility space, it isn't always funded or designed to reach that standard. Partly because running that kind of trial is actually pretty expensive. And for big pharma companies, there's not much financial incentive to thoroughly research something inexpensive, especially if you stop taking it once you conceive. So I don't think the gap in evidence automatically means that a supplement doesn't work or that it isn't worth looking into. It may still have real benefit. And if you speak to practitioners and they often find that their patients get the same result after taking this one thing, it may still have some real benefit. But just be mindful that there can be lots of factors that change with each person taking a supplement, things like age or genetic makeup. So the decision with what you take is in your court, but I do think it's worth holding any claims just a little bit loosely rather than treating any one thing as the silver bullet to pregnancy. And I think one thing for me surrounding implantation that I found really quite frustrating was that you can know what is meant to happen. You can know what the measurements are meant to be with your endometrial lining, but other than the ultrasound, and even that isn't 100% accurate, you don't know if implantation will happen for you. I remember lying in my fertility specialist's room, watching the ultrasound screen, intensely praying and willing for that number to be above 8 millimeters, because I knew if it wasn't impossible to get pregnant, but my chances dropped that little bit more. And when so many things already need to line up, every number on that screen can feel enormous. And in some cycles, I felt like I'd done everything I possibly could, and my lining still didn't respond in the way it had done the cycle before. And my specialist didn't always have a clear answer for why either. And I think there's a particular kind of frustration, not necessarily anger, but this almost exasperation at how much is genuinely out of your hands. And at times out of your specialist's hands as well. Your specialist cannot force an embryo to implant and continue to develop. And that's God's domain, but it can be just as hard when there's no direct answer as to why that's not happening. One thing that can be a sign that implantation may have happened is that you may get some spotting around the time that implantation would usually occur. And this can vary a bit based on whether you're trying naturally or doing IVF. If you don't get any spotting though, that doesn't mean implantation hasn't happened. Plenty of women have had nothing at all and go on to have healthy pregnancies. And if what you're experiencing turns out to be your period, it won't just be light spotting. And that is the dreaded thing, that desperately hoping that your period is implantation bleeding and not your period. But other symptoms like cramping or sore boobs, tiredness and bloating, they can feel like signs as well. But those symptoms can show up either way, whether you're in a natural cycle or on progesterone support through IVF. The only way to really confirm implantation has happened is a rising HCG level, which is what a pregnancy test picks up, or what your specialist is measuring when they do a blood test after a transfer. Before this, there's no real way to know for certain, which I think I've said before, I find pretty astounding. There's lots that medical technology can do, but in these few days, even fertility specialists are very aware that they have zero control over what's happening here. So that's my little take on implantation. I'm sure that there's much more that I haven't covered, but I hope some of the takeaways that you get from this episode are that there are things, real things that are worth doing to support implantation. Getting your iron checked, looking into your thyroid properly, investigating conditions like endometriosis or adenomyosis if you find that you've got symptoms, asking your specialist or naturopath about your lining, what they're seeing and what can be done to support it. Those things can be helpful, and I do think they're worth pursuing. And at the same time, as you probably know by now, and I always circle back to this, as a follower of Jesus, we know that God is the one who determines life. Implantation involves things that we can influence, but we can't control. Even the best preparations can't guarantee what happens next. And that's not necessarily a reason to give up or stop trying altogether, but I do think it's an invitation to keep holding this gently. Do what you can, ask the questions to your doctor, and then, as hard as it is, trust, even when what happens next is not entirely in your hands. We believe in a God who holds what we can't, and that can give you strength when things like implantation are complex and uncertain. Thanks so much for tuning in today, and I'll see you next time. Bye. Before you go, thank you so much for listening. I pray today's episode has brought you fresh hope for whatever comes next. If someone comes to mind today who could truly use support in this space, please share this episode or the podcast with them. It might be exactly what they need. And if you could take 30 seconds to give me a star rating or leave 1 or 2 sentences about what this podcast has meant to you on Apple Podcasts or Spotify, I'd be ever so grateful. Your feedback not only helps others find the podcast, but it truly makes my day. And words of affirmation are my love language. And if you're not sure how to do that, I'll pop the links in the show notes below. Lastly, although I do have a nursing degree, everything shared in this podcast is for inspiration and education only. Please don't use it as a replacement for advice from your personal medical or mental health professional. There's absolutely no shame in getting additional support when you need it, but always consult your expert team before making any changes to your fertility journey. That's all from me today. Take care, and I'll catch you next time. Bye.